firstly range of motion exercises and take a look and see how the range of motion looks. So first thing I'll ask patients to do is, let's see how you look with abduction all the way to 180 degrees. Very good. Okay, and I'll have them come down here. Okay, and then we'll look at forward flexion and see how they do forward flexion. Make it up to 180 degrees. Excellent. Very good. I like to have them come down here, and then we look at external rotation. So this way we can do external rotation to see how they do back here. Very good. And I have them turn around. Okay, I have them put their hands separate down here, and then this is the Apley scratch test. See how high up they can go. And see if it's symmetric, and that's very good. Okay, one other test we can do here is called the lift-off test, and this is where we go like this, and this is evaluating the subscapularis or internal rotation. So a positive sign would be if they had difficulty lifting off or if they had pain with doing that. Okay. So then we can do some strength testing to evaluate the strength. So empty can test, evaluating for supraspinatus. Shoulder out 90 degrees of abduction, forward flex 30 degrees. Point your thumbs down. Ask the patient, don't let me push you down. Good. A positive sign would be if they had pain right over here at the insertion at the greater tuberosity of the humerus, or if there's weakness. Okay, so that's that would be a positive empty can sign. Okay, we check for external and internal rotation. I have the patient keep their elbows locked into their torso. Okay, we have them just bring it out and in, and then we're going to resist. So push out. Okay, very good. This is evaluating for external rotation. Okay, and then we have patient push in. Okay, and this is evaluating for internal rotation. If there is a rotator cuff injury, what we would see is pain with those maneuvers. Okay, I like doing palpation. So as I mentioned in the lecture, what we start with is I palpate over the sternoclavicular joint, okay, and then we can palpate over the clavicle to see if there's any pain. And the clavicle articulates right here at the AC joint, right at the acromion, and so we can palpate to see if there's any tenderness at the AC joint. I like to palpate the coracoid, which is just inferior, to see if there's any tenderness there. Again, that's where the short head of the biceps inserts or originates right here at the coracoid process. So I like to palpate there as well. Okay, moving on to some impingement tests. Okay, so Hawkins impingement test, arm flexed to 90 degrees. Okay, I ask the patient to let the elbow fall into my hand. Okay, elbow flexed to 90 degrees. Okay, and I just take their hand and I internally rotate them, just like this. Okay, and what we're looking for is pain in the subacromial space to see if they have pain in that area. Okay, Neer's impingement sign. Okay, this is where we passively hyperflex the arm, okay, up to 180 degrees, and during the arc of flexion, we see if there's any pain that occurs while we're doing that. Again, in the subacromial space. Okay, so we can move on and do the cross arm adduction test. Arm is flexed to 90 degrees here. Okay, and then we bring it cross arm across our body. Okay. And what we're looking for here, a positive test would be if the patient complained of pain and stated that it was located right at the AC joint. Okay, that would be a cross-arm adduction test. Okay, and at this point too, what I like to do is the O'Brien's test. So I have the patient bring their thumb up, okay, and thumb down. Usually they'll have pain when they bring their thumb down with a labral injury, and then I'll ask them to try to push their arm up into me, and I'll provide resistance. Okay, this would be a positive O'Brien's test if there's pain in the glenoid, deep in the joint. Okay, so moving on to biceps test. So Speed's test, arm is flexed to 90 degrees, elbows extended. Okay, examiner provides resistance. Okay, and a positive test would be the patient complaining of pain in the bicipital groove, right between the greater tuberosity and the lesser tuberosity. Okay, moving on to the Jorgensen's. Okay, elbow flexed to 90 degrees. The examiner takes the patient's hand, has the patient pronate, and then the patient is going to supinate, and the examiner is going to prevent them from doing that. So we'll have them supinate like that, and I'll resist you. Good. Okay, and again, looking for pain at the bicipital groove for the long head of the biceps. Okay, let's go over the instability sign. So we'll turn to the left here. Okay, so we have the sulcus sign. Okay, the sulcus sign is when we inferiorly displace the humerus. Okay, and we can't see it here because of the shirt here, but what you would see if there was a positive sign is you'd see a separation between the acromion and the humerus. Okay, and you'd have a space in there, and that would be a sign of instability. Okay, load and shift test is where we grasp the clavicle and the scapula with one hand. Okay, we take the humerus and we load it into the glenoid. Okay, and then we articulate it anteriorly and posteriorly, and we're seeing how much the humerus translates in an anterior and posterior translation plane. Okay, positive would be greater than 25% anteriorly. That would be a positive load and shift, and we grade those in different grades: grade 1, grade 2, and grade 3. Okay, and lastly, we'll have Jeff turn and face the wall this way. This is what I was mentioning to you guys before about evaluating the scapula. Okay, so I palpate the scapula, and I have the patient slowly bring their arms out to the side, and then I watch my thumbs. I have them bring it down again. Okay, an abnormal scapular finding would be if you saw that the scapula winged out like this when they bring their arm out. Okay, as you can see when Jeff did it, he was nice and symmetric out here. Good. An abnormal finding would be if he did that and abducted, you'd see one side really wing out and the other side not as much. And then you have to think about doing scapular stabilization exercises. So any